For some, coming to a periodontist is to replace dentures. Let's hear about Orest's experience. So, Orest, you've been coming here for 12 years.
11, 12 years.
11 or 12 years. What brought you through the door for the first time?
Okay, I neglected my teeth at my young age to the point where I ended up with dentures, full upper and partials on the bottom. But I knew always that that wasn't going to be the end of my dental work. I wanted something more permanent. I didn't want to wear dentures the rest of my life. And we went through a procedure, we went through analysis, x-rays, this and that. And I decided to slowly start implant work.
So talk to me a little bit more about the initial consult. What was it that the periodontist did that made it more comfortable for you, or made you feel more sure of your decision?
You know what, I mean, for me, one of the first things was just his mannerism to begin with. The doc was just, like down to earth, took the time, explained it. He wasn't overbearing with it. I had some other issues where my bone had receded. My nasal bone structure had receded. He explained that he would probably, before he started the implant surgery, would have to do a bone graft nasal lift. That whole process probably took about 6 months to 8 months before he even started the first work. But I think maybe 3 or 4 visits, different consultations, different x-rays. And then we started off with the nasal lift bone graft, and that had to heal for about 8 months. And then we slowly, started doing the implant work.
So obviously he told you what was going to happen before it happened, and then it happened. So compare and contrast what you were told was going to happen versus, what happened when you actually got here.
You know what, I didn't have too many preconceived notions of what was going to happen, but I did have, and one of the reasons my teeth were in such sad shape was I had a great fear of dentists, dental surgeons, all that stuff. Growing up in the 60s and 70s, dentistry was not where it is today, and hence I had fears that way.
Right.
From my first procedure here, the worst thing to me was just, the actual freezing. After that, I was so at ease here that on a couple of occasions when he was either doing the sinus lift or even when we got into doing the first implants, and I'd be in the chair for 2-3 hours, and stuff like that, a couple of times I fell asleep. I had some major serious work done, I mean, it wasn't just in and out, half an hour, fix this, fix that, and see you later. It's, I would recommend this procedure with this particular doctor to anybody.